Hello, everyone, and welcome to our virtual town hall presented by the Canadian Institute for Public Safety Research and Treatment. My name is Emily Kosick, and I'm the Knowledge Manager at CIPSRT. Our topic today is risk and resilience to moral injury in public safety personnel and healthcare workers. We're going to have a presentation followed by a panel discussion and a question and answer period. I encourage you to send your questions for the panels and presenters through the question box throughout the presentation. Now I'm going to introduce our panelists and presenters. First, Robert Stewart, who is the Director of Emergency Communications for the City of Brandon. I'll just give a wave there for us, Robert, that'd be great. All right. Next, we have Wade Wallace, who is a Lieutenant in the Ottawa Fire Service and a member of the Fire Services Peer Support Team. I don't think Wade has his video on at the moment, but you guys will see him later. Next, I'll introduce our panelists. Our presenters, I apologize. I first have Dr. Ruth Lanius, who is a professor in the Department of Psychiatry at Western University. You want to give us a wave? Wonderful. And our second presenter is Dr. Margaret McKinnon, who is an associate professor and the associate chair of research for the Department of Psychiatry and Behavioral Neurosciences at McMaster University.
Hi, everybody. Hi.
All right, so I'm going to turn it over to our presenters who are going to give a brief presentation and we'll go from there. Thanks so much, guys, and good luck.
Okay. So it's really an honor to be here today, and I'd like to begin by thanking CIPSRT for this invitation, as well as the community for joining us today. I think it's an important opportunity for dialogue and for us to have conversation between clinicians, scientists, and the healthcare and frontline professional public safety personnel community. Ruth and I just wanted to start. I'm just going to see if my slide will transition. We wanted to start just by giving a brief overview of the talk, and primarily we're going to focus on the impact of the current COVID-19 situation on thoughts and feelings that people might be having around the ethical quandaries that they may find themselves in. This might present a risk from moral injury, and also how organizations and individuals can best support one another through this pandemic situation, because that really is the goal for all of us, to support one another. We just have a disclaimer that the views and opinions that we'll be expressing today are not those of McMaster University, Western University of Canada, or CIPSRT. They really are just our individual perspectives, and they reflect the most current information we have, meaning that some of the information coming in right now could change in the next couple of minutes or next couple of hours. And I know that everyone here on the call has likely had that experience that you've made a decision or you've been asked to do something, and within minutes the situation has changed. And that seems to be a lot of what's at the heart of COVID-19, is that we don't really know all of the answers. And often when we think we have the answers, suddenly everything changes. So we will be addressing that point today as we go through the talk. These are our affiliations. So as Emily had mentioned, Ruth is the Harris Woodman Chair in Psyche and Soma at Western University of Canada. She's also a consulting psychiatrist at Parkwood Operational Stress Injury Clinic, and may know some of the people here on the call through that. As mentioned, I'm an associate professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster. I'm also the research lead for mental health and addictions for St. Joseph's Healthcare Hamilton, and I'm a senior scientist at Homewood Research Institute. And I hold the Homewood Chair in Mental Health and Trauma, and it's really an honor to be here today representing that chair. So Ruth, maybe do you want to start with this slide?
Sure. So we just wanted to put in some provisions, and one is that no one can fully prepare for a pandemic. And I think that's really important to be aware of when we think about what we could have done better, or what we, maybe didn't do as well as we thought we could have. Nobody's ever prepared for a pandemic. And what this is really about is working together to make the best of it and to help each other in the best way that we can. And again, when we get stressed, it's easy to start to find another person to blame. And we want to move away from that, even though that's a normal human response. And what this town hall really is about is how can we work together to make the best of this very difficult situation, and really giving everybody the benefit of the doubt that, and being aware that they are doing their best. This is difficult for all of us, and there's going to be days at the end of the day where we're going to feel, oh, this was just a dreadful day and I could have done much better. But that's just life. especially under these difficult circumstances. You know, all we can do as human beings is do the best we can each day. And some days that's going to be better, and some days that's not going to be as good. And that's okay. We're all human. Margaret, do you want to go to the next slide? Do you want to go to the next slide?
Yeah, sorry about that. My audio just cut out for about 2
Oh,
minutes.
sorry about that.
So which slide are we on? So we're at the
We're
bruise.
on provisos.
Okay, sorry everyone. Sorry about that. Can everyone hear me?
Yes.
Okay, so I would like Ruth, can you just orientate me to the slides? I'm sorry, I couldn't hear anything.
This is the slide of the quote of the veteran who says, you know, I couldn't look anyone in the eye for fear that they would see the stain on my soul.
Right, and I think this is a really important concept within moral injury. The notion that it's a bruise not only upon yourself, but also often upon your soul. And people talk about, and I know we often hear this from the first responder community, that if others could see inside of them, they might see the bruise or the invisible injury of PTSD. And with moral injury, it goes a bit farther than that sometimes. People talk about a bruise upon their soul, that if others saw them, they couldn't possibly understand on the level of difficulty or what they've seen that others in the community have not. And I certainly think about the COVID-19 situation where people talk about what happens to them in the hospitals, on the front line, in the communities, and how other people couldn't appreciate that experience, people who are civilians, because they haven't seen that. And this quote illustrates it really beautifully, where a veteran was asked about the bruise upon his soul, and he said, "It feels really scary. I feel like they're going to see some kind of stain upon my soul, a sense of shame about being in the situation in Vietnam. And I also know that some of the things I witnessed and I couldn't do anything about. For example, when they threw a grenade in a hole with a guy and knowing full well what the outcome of that would be." So these are the situations that he's faced and the shame that he feels around them. And he says, I mean, if somebody found that out about me, they would think that I'm sorry, I can't see this. I'm sorry, it's really having a little bit of trouble, guys, with the the audio visual because of the bandwidth issues.
I can read it, Margaret. I mean, if somebody found out about me, they might run. Previously, I'd been in a PTSD group, and there was one of the other guys in the group said that when he looked into the eyes of a person that hadn't been at Vietnam, it was kind of like looking into the eyes of a baby. They just were innocent. I have that same experience. Part of me wishes that I could get that innocence back. That's something I really wish very often. And I think that's also something important to keep in mind, and something I've learned from working with first responders and veterans. You know, asking people about guilt and shame often isn't that fruitful because people don't connect with it as well, and it's very difficult to talk about it, right? Because we feel bad about how we are when we feel shame or guilt. And so asking somebody, for example, do you ever have difficulty looking someone in the eye for fear that they will see the stain on your soul, can sometimes be an easier way of connecting with those feelings of someone. That's certainly something I've learned.
And you know, we've been really fortunate at Homewood Health Center in Guelph that we've had the opportunity now to interview about 65 first responders about their experiences that sound in many ways to us similar to what we hear from the Vietnam veteran that Ruth just spoke about. And we asked about the concept of moral injury and asked people if that was relevant to the first responder community. And that certainly was the case, where people said, you know, it's the moral injury that really troubled them after an event or after an incident. And I think one person said this very eloquently when he said that it's those moral injuries. It's not just one trauma. I liken it to, it's like getting that little rock in your shoe where you can walk 10 steps and kick it out, and it's okay, 10 more steps, and then you get another pebble in, another incident that troubles your soul. You do that over 10 years and you walk around with those pebbles in your shoes. And it begins to irritate you after a while, all of those pebbles. And that's what I find in my experience. And that's what kills me. And sometimes it's the big things that are the straw that breaks the camel's back. But after many, many such experiences, sometimes it's just the small. And I thought that was just a beautiful way of capturing some of the experiences that people have out on the front line. And being a clinician myself, I know that sometimes it's the cumulative of the many different burdens that come together to really make that break that we feel sometimes out of these stresses, and the stresses that really leave us in moral or ethical quandaries. And we want to be really careful here to talk as well about how we're talking about, for example, police officers, firefighters, corrections officers, dispatchers, and other members of the public safety.
Margaret, I apologize. We've just lost your sound.
Pandemic. So we certainly know, for example, having to make difficult decisions about care without knowing all of the information, about not knowing what care might be most appropriate in this moment, and then having to make a decision, knowing that within minutes or hours or days, appropriate care might change, our knowledge of the virus may change, and having to make those choices. That can certainly present a level of moral injury or moral quandary to individuals in the healthcare community, as well as public safety personnel, such as police, fire, ambulance, dispatch, corrections officers, and other experiences that we'll be hearing about today from our panel.
Yeah, and so what are some risk factors for moral injury? And there's a number of risk factors that I think we need to be aware of. And one really pertains to leaders. And I think leaders can really make a difference in whether individuals develop moral injury or not. And so this also means that there's something we can actively do about moral injury. And so leaders that are not perceived to take responsibility for the event, I think, can be a risk factor for the development of moral injury. Leaders that are perceived as being unsupportive to staff, I think, are a risk factor. And if staff feel unaware or unprepared for the emotional and psychological consequences of decisions that they have to make, I think that can be a risk factor. So what we're really talking about is transparent leadership, right? That the leaders sit down with their teams and be upfront, right? That this is a pandemic. You're never going to be optimally prepared. And this is where we're at. This is what we have. And how can we solve these problems together, right? If I'm the leader, I don't have all the answers, and I really rely on the whole team to make these decisions together. And I think that helps everybody to have a sense of control and a sense of, being involved in the decisions. And I think lack of social support can also be a big risk factor. We know how important social support is, and the public safety personnel are so good at social support and peer support. So that's absolutely critical in decreasing the risk for moral injury. And then I think it's also important to realize, often people have had early traumatic experiences where they felt helpless, where they felt a loss of control. And so feeling a loss of control and feeling helpless or not heard in this pandemic can trigger those old difficult emotions, and they can be reactivated, and somebody can become very dysregulated as a result as well. So really being aware of what's being triggered by the present situation and what may be triggering some past traumas is also really important. And that awareness can help us to deal with those things in a much better way. Do you want to go to the next slide, Margaret?
So we know, and again, I'm going to apologize for the bandwidth. If I cut out, I do apologize, but I can now see the monitor. So we know that with our healthcare workers, there's been some really early work done around how can leaders and others working together best assist one another. And some of this work has already come out, and it suggests that there are key questions that healthcare workers are asking of their leaders. This includes see me. So see me for who I am as a unique individual, what some of my vulnerabilities, for example, having a previous history of trauma, feeling unsupported, see those vulnerabilities in me and help me as the unique individual that I am to get through this particular time with the COVID-19 pandemic. Healthcare workers also need to hear from their leaders that they will protect them so that wherever possible, PPE will be provided, but also training. So we're hearing a lot from our healthcare community right now. Train me as best you can to do the work that I need to do now. Whether that's the appropriate donning or doffing of PPE, whether that's giving healthcare workers and frontline personnel the most current information available surrounding COVID-19. We're starting to see, for example, that there are different presentations of COVID-19 that might require a different type of treatment intervention and also may require healthcare workers and frontline personnel to act differently and to respond differently. And healthcare workers are asking that their leaders, as well as frontline personnel, are asking that their leaders provide them with the most current information available. Healthcare workers, as well as public safety personnel, want to feel supported. And part of that support is the knowledge that the leader or the organization will care for them if something were to happen around COVID-19. So for example, having the knowledge that if something happens to me, care will be provided for my children and for my family, that all available interventions will be provided to me, and that the organization will back me up 100%. I was just talking to a colleague about how some people in the healthcare community are feeling that there might be a stigma around having had COVID-19 or being someone who suffers from it as a result of a line of duty injury, so having COVID-19. We really do need to challenge that stigma. We need to know that when someone one of our workers does contract COVID-19, that they'll be fully supported. And that extends both to the organization, to the leaders, but also to their co-workers in not stigmatizing individuals who do inadvertently, through no fault of their own, become one of the sufferers of COVID-19. It's really important that we don't stigmatize that. Bruce and I would add in conversations with military members and military leadership that it's also really important to include frontline workers and healthcare personnel in discussions and to include them in decision makings. A really good example of that would be if there is a limited supply of personal protective equipment. Can we go back to the front line and ask, how should we distribute this information? You're the ones doing this work. Tell us what the best way is to make decisions. What are the best choices we can make right now around the distribution of these limited supplies? Again, if we have limited medication or treatment available to individuals who do have COVID-19, how should we make decisions about how to distribute that medication? What are the sorts of patients who should receive it? And help us to work through those really tricky or wicked problems that Alex Hebert and Suzette talked about in the earlier town hall. Include the frontline personnel in making these decisions. And as I had said earlier, tell me all the information that you have at hand. Tell me the risks that I'm taking on right now. Whatever information you have, I as a frontline person need to have that information as well. That's incredibly important in order for our healthcare workers and our public safety personnel to feel supported in the hospitals, in the jails, out on the streets, in the fire halls, in the police community. Tell us the information that we need and tell it to us as quickly. If you have it, tell us as well. Bruce, do you want to take this one away?
Yeah, maybe I think it's time to go to the last slide, Margaret, because I think we're running out of time.
Sure.
And so, how can we work with moral injury? How can we, really make that emotional injury heal quicker? And I think the first thing to do is to acknowledge that we're human, right? And the fact that we are feeling guilt and shame is a very human thing to do, and it's actually a very caring thing, right? It shows that we have feelings, and I think it's essential that we acknowledge that because we're human, we're all going to have vulnerabilities, right? We're all equal in that. And I think also when you start to feel guilt and shame, that means you're a leader in your community. And I always talk to the first responders and to the veterans I work with when they tell me about their moral injury or their guilt and shame. I say, you know, this means that you're a leader, that you care about the others that you work with. And I think it's really important to appreciate that, both in yourself, but also in others suffering from this. I think we really have to encourage self-compassion, and I think that's by understanding that we're human, that we're vulnerable. I think that helps us to increase our self-compassion, both for self, but also for the others around us, right? We're in this together, we're all human, we're all vulnerable. So let's take care of us, but let's also take care of our peers. I think that's very important. And I think this brings us to the next point, how important it is to have social and peer support, right? And to share those, you know, really painful experiences of guilt and shame in a group setting. And I think this really helps us to feel much less alone, right? I think people, because it's so hard to talk about shame, often people look down when they feel shame. They're in a collapsed posture. It's so difficult to talk about. But when we're in a group setting and we hear others talking about very similar emotions and very similar pains that they're experiencing, I think that really helps to decrease that feelings of aloneness. So I think this is something that can be overcome. I think it's something we need to be aware of. And I think it's something that we can overcome together. And so on that note, I'd like to turn it over to Rob and Wade, who have incredible insights on this topic, for a discussion.
Yeah, Robert Wade, we'd really like to hear your reflections on the points raised today and how it fits with your experience and maybe even how it doesn't. Really what you would say.
Hi, Ruth, can you hear me?
Yeah.
Yes.
Yeah, we can hear you, Wade. We just can't see you.
Bob, when you hear this information, how does it resonate with you and your experience in the dispatch and communications community?
I think public safety communications has the same propensity for moral injury
as yeah, I'm trying to
as the other public safety agencies do. An added on sort of concern or factor for us is the sense of powerlessness when we're talking to people on the phone, we're hearing what's going on, and all we've got is words. We don't have actions. Having been a paramedic in the past, I know the difference between those two things, being able to get your hands on and do CPR, or get your hands on and sort of help to prevent somebody from hurting themselves, whereas on the phone, we don't have that opportunity. And so I know when I was a dispatcher, and my staff will relate the same, we take a lot of that home with us because it's we're powerless. We talk on the phone, and all we've got is the training to try to sort of understand and pass the appropriate information on, which leads to the next problem, which is making sure that we get the appropriate information. And we're responsible for the safety of all of the responders that we're dispatching out, that we're giving information to. And if we miss a piece of that information, things can happen that we don't want to happen. And again, we worry about that. Our primary responsibility is responder safety. Our close secondary responsibility is that to the public.
Mm-hmm. In the sense that that could have, if you make a decision, if you make the right call, or if you feel like later on you make the wrong call, or that others talk to you about decisions that you made, that you were talking to us about the other day, that they may often question your judgment as well. And I can imagine that's very difficult to face.
Well, and you see that, right? The other agencies don't necessarily, just like our agency doesn't. The other agencies, between the 4 or 5 groups of public safety, we don't really know the jobs that each other do for the most part. I mean, I was a paramedic working in the dispatch center, so I understood what paramedics were doing, but none of my staff are policemen, none of my staff are firemen right now. And so, and none of the policemen and firemen that are out on the roads necessarily are call takers or dispatchers. So because we don't know each other's job, it's easy to second guess what they're doing. They don't know. The people on the street don't know that I've been talking to that caller for the last 20 minutes while still trying to pass on information.
Yeah, and I would say, Rob, that it's really important, particularly during this pandemic, for all of us to come together, all the different communities. We certainly see that when in the hospital setting, where we see psychiatry, psychology, medicine, all this coming together to heal relationships that for many times have been difficult. But I think here we have a unique opportunity to come together. Wade, it is absolutely terrific to see you in your uniform. So nice to see, and just to have you representing fire today. And I'm wondering if you have any reflections on what you've just heard, the discussion as well as what Rob has said as well. It'd be wonderful to hear from you.
I think what's interesting is Rob and I did have a discussion yesterday about the differences between support from a communications center versus on the front line. In a lot of ways, they're exactly the same. You have when your activation comes in, it comes to a call, and what happens is everybody who touches that incident gets affected some way. And a lot of times we don't see that because we're in our little bubble. And then once we get to talking about it more and more, we start to realize the breadth of that situation, how it affected everybody. And I think what's interesting is you talked about leadership before. Our leadership team is great because they provide the latest technology for us to understand what the situation is. So they're constantly updating the best practices. They're out there researching, making sure we have the best tools, the best protocols. And they also want to make sure that we have access for our mental health. They want to make absolutely certain that we know that if we have an issue, that we have resources available to us to talk to somebody and to get the access to the information and resources that we need. And in this day and age, it's incredibly different because of the pandemic, but we have to maintain our protocols, but also understand that we have a higher responsibility now to make sure that we help the community as much as we can because of the situation. And so the empathy side becomes a real issue. Our mandate is to prevent further harm, right? And so if we get into a situation where it's very difficult to handle a lot of things, we have to rely on the other resources like Robert was saying. And we have to make sure that we don't overuse comms, for example, because they're having 4 or 5 other conversations during the call that I'm on them with as well. So the more we understand each other, the better we can work with one another. And we are human, we hurt like everybody else. And one of the things that, again, Rob and I were speaking about yesterday was we do appreciate the thanks that people give us, but that can be overwhelming at times too, because it puts the focus back on us again. And as first responders in any capacity, it's very difficult because, like your presentation had mentioned, it's you have your head down, you're trying to do your job, that's what we signed up for. But sometimes the focus is really a lot. When they look back at us a lot and they say thank you so much, or they give gifts, and it's hard, we can't accept those, and it becomes an even bigger responsibility at that point. So our identity is to help others, it's not to get help, and that's usually the first barrier to mental health. And that's why programs like this are so important, that people understand what the first responder or what the veteran or what the person who has had that trauma really can relate to.
Yeah, I hear a lot in that way, because it sounds like there's some really good leadership in providing you with the information that you need immediately. As soon as leadership has it, they're sharing it with you. But also some of the challenges around, being a person who is out on the front line, and we hear this from first responders all the time, having to go back home and become a father or a mother right in that moment. When they've just returned home from something very difficult. And I really heard the theme from you and Rob as well of caring for one another. So bringing together the different professions, healthcare and first responders coming together to support one another, providing care and comfort to one another. And I really heard that in what you were saying, Rob, and Wade, and I really appreciate that message, and how difficult it is when we've all been trained to go in and be as professional as we can be, but at the same time feeling our own lives are at risk because of the work that we're doing right now, more so than normal. And I think that's really challenging. And then how do we feel and extend to have those same feelings when we're also under threat as well as a community, as healthcare workers, and as public safety personnel. And I really appreciate you talking about that, Wade and Rob. It's really helpful.
And maybe both of you could comment briefly what you would recommend to your colleagues when they're having a difficult time reaching out for help, because as you talked about, that can be so difficult, right? Because you are always the caregivers, right? And so receiving care can be very difficult. What would you recommend to your peers?
I think from my perspective, and Wade and I talked about this a little bit yesterday, there's this belief that public safety personnel are stoic. They don't want to tell anybody about what's going on because they're macho. And I don't know that I believe that that's the reason. I believe it's more of a, this is just part of the job. I have to deal with it. I have to sort it out. It's what I signed on for, so it's a byproduct. So this is what I'm going to have to do. And unfortunately, that's as difficult a behavior as being too macho to tell anybody about what's going on. So I would challenge public safety personnel to change that mindset a little bit, that yes, you signed on to help people, but you didn't necessarily sign on to increase your level of mental illness, especially when there's treatment and there's people to talk to. And so reach out and use those people, use your peers. I would highly recommend that we work in a very team-based environment across all of the public safety sectors. And so you've got some friends, you've got people that you work closely with. In the communication center, you've got 8 or 10 other people you're working with regularly. In the ambulance, you've got a partner that you're working with all the time and a team back at the station. And in fire, you've got a team of anywhere between 3 and 6 people, maybe more at any given time. Use those people, and as those people, pay attention to how your coworker is doing. And let them know if you're seeing something, and say, hey, do you need to talk to somebody? Because we can arrange that.
Wade, do you have any thoughts?
I agree with Robert 100%. I think it's interesting. The barriers to that kind of care typically is the identity side, like we said earlier, where it has an issue of, yeah, we did sign up for this. I agree with Rob 100%. I think one of the problems is people think that they're going to be taken off that responsibility if they admit in some capacity that they have a mental health issue. And it's very difficult to assess yourself and say, I have a mental health issue. Well, what is that? Are you just stressed? You know, everybody's stressed. How do you identify that you have an issue? And you know, thank God now we have a lot of tools and resources out there that you can self-assess, and you can actually compare that to data out there that helps you understand just how far along that process you are. So you can self-assess and say, you know what, maybe I need a little bit of attention. I can talk to somebody about it. And the second part is, if they take you out of the front line, it's not to take you out there permanently. The goal of mental health is to make you resilient, you know, to keep you in the game, to keep you in the fight, to keep you providing that care that you can. And so the leadership team that we have has been instrumental in leading the way, so that we all understand that the goal of mental health is to get you back and to keep you resilient long term.
And I think, again, we come back to being human, right? Every human being with enough exposure is going to have some difficulties, right? There's no one that with enough exposure is never going to have difficulties. So again, it makes us all equal. We're all human, we're all vulnerable, and with enough exposure, we're going to have some symptoms. And reaching out is a strength.
I think that's an interesting concept, Wade, because if you're going to use a sports analogy for that, you get pulled out of the hockey game, or you get pulled out of the basketball game, you get pulled out of the volleyball game, but you're not pulled out for the whole game. You're pulled out to take a rest, to get things back going so that you're ready to go back in the game at full power. And for me, what you're talking about, Wade, is the same thing. Sometimes you need to step out so that you can get back to full power, so that you can go back to doing what you signed on to do.
And I think, Wade and Rob, you both raised such an important point around what are the consequences of reporting. And you're really, for example, with police officers, the fear of losing the gun, right? That we hear that all the time. But again, it's that idea that, no, you're out for a while, but you're coming back, and you're coming back stronger. What's forged in fire is stronger. Steel forged in fire is stronger when it comes back out, right?
interrupt for a moment, guys, and we can start taking some questions from our audience here. So the first question that I have is a comment to your last slide about the antidotes. And they're important things to remember, but it does come down to more an organizational change for some of those elements. And how do we overcome any obstacles in the organizations to allowing those kind of conversations to happen and those kind of antidotes to happen? What are your thoughts and suggestions on how cultural obstacles in an organization can be overcome?
And I think CIPSRT is addressing that directly. They're actually having webinars with the leaders as well. And I think these changes really have to come, from the leadership. And I think CIPSRT is really working very closely with the leaders to ensure that all organizations will have similar views on that and really help each individual to achieve the best mental health they can.
Yeah, and I want to comment on that as well, if that's okay, because Rob, our Wade brother, you're here in your uniform today as a captain, and you're talking about mental health, and you're talking about your own experiences as well as the experiences of the men and women that you serve with. And I think you're modeling good leadership here today, and that's just as Ruth is saying, it's so important for the leadership as well as frontline, everyone to model for one another how they can be straightforward and upfront about their mental health, that they can come back from challenges stronger than before and resilient, and how everyone can again support one another. I think that modeling of the human experience, as Ruth said, is just so important, and letting people see our vulnerabilities, but also how we can work together through treatment and through peer support and other mechanisms to help others with their mental health difficulties as well as our own.
Rob or Wade, do you have any comment to the person's question?
I think for me, it's all about communication. That communication is both
thank you
ways,
for that.
And that if you've got the trust,
I
think trust is the key. So if you can build that trust, and as the director in our center, I need to be able to pass on the messages, be willing to pass on information, be willing to do what's needed in order to make sure that my staff stay healthy, whether it's mental health first aid or road to mental readiness, make sure that they have all the tools that they've got. And then from a staff responsibility perspective, it's also, they have a responsibility to make sure that they let me know what's working and what's not working. And when I ask, and I should be asking what's working and what's not working, be ready to answer those questions so that we can make the workplace better together. I have a lot of responsibility as the sort of leader of my center to help guide the direction of that. Really, I'm making the setting a good setting, and they're the ones that are telling the story. And so they need to be willing to sort of move along the path.
I want to say too, if I could just make one more reflection, is that, we're all the front line, whatever our roles are, whether we're administrators, whether we're providing face-to-face care or going directly to the calls, we are all the front line in this pandemic, and we need to come together as one around some of the decisions that are being made, but also our sense of community surrounding that. We're all out there.
Yeah, thank you for that. Wade, I'm going to give you a chance to answer. I apologize. I said you and Robert at the same time, and I should have just picked one of you. So Wade, if you want to go ahead and answer that question, I would appreciate it.
Well, I agree a lot with Robert there. Sorry, there is a delay in my audio, I think, so I'm catching this a little bit off the side. First thing, I'm a lieutenant, so if anybody knows, there's only one stripe, it's a lieutenant.
Oh,
the other, so captain has two, but that speaks a lot to the level of leadership that we have, that everybody on every level knows. It's no problem. So the thing is, it's within our entire organization, and that's when it starts to work. If you have a small group of people trying very hard to promote mental health, and you don't have the support from the leadership team, it doesn't just stop, it actually gets worse, because then they become so much more separate from the floor or from the first responders who are out there doing the work. And it becomes its own little niche, and then it becomes frowned upon, or the people who don't understand how it really is. And that goes against everything that the first responders, I think, stand for today. By having leadership team take the initiative and listen to the floor, like Robert said, you set up a great environment, and now you have the resources available, but also you're supporting each of the leaders, so the captains, the lieutenants, all the sector chiefs, the chiefs,
Lost your sound, Wade. So we've lost Wade for the moment, so I apologize for that. I'm going to go on to the next question, and I'm going to start with Robert for the question. The person asked, what can I do if my leaders aren't backing me? If perhaps they're too busy, they have too much responsibility pushing on them from the top, or they're just not able to provide those resources for me. How can I act as a lower down public safety person? How can I best help with the situation when they're not able to back me?
I think that's a difficult situation to be in. And I wonder, are there different levels? So for example, do you have a supervisor on the floor with you or in your workplace that you can work with? I mean, I can't make excuses for management. Management should be making time to deal with the important pieces. Are there outside agencies? Is there peer support that you've got outside? I know that I know after talking to Wade yesterday that if I specifically had any problems and had nowhere else to go, I could reach out through Wade's network and help to be able to and get some help and get some support, some peer support that way. Public safety is really all in this together, and part of it is trying to get your leadership, if they don't already, to understand that we're one big family. We're not a whole pile of different silos. We're not a whole pile of different industries. We're all public safety personnel, and there's more similarities between what we're doing than there are differences between what we're doing. So continue to try to work at your own management level, and continue to sort of, for lack of a better word, rally the troops and gently try to convince your management how important this truly is. There are resources out there. CIPSRT is one of those resources. APCO Canada, if you're a communications official, are another one of those resources that can help to provide resources to your management, to your leadership, to help them understand. In the short term, the sort of, what can I do right now? Find some other services. Is there another communication center? Is there another fire department? Do the police in the area have help available for them that they can then extend out to you? There are options. Some of them are better than others, but there are definitely options.
Can I just say something about that, Robert? I think what's
Go ahead
interesting
and add,
is
Wade. Yeah.
we have in Ottawa specifically, we have all our first responders working together. We have a peer support team for each one. In the last few years, we've actively worked together to provide the best practices for each other. So, he's right. We're not in a silo by ourselves. The best practices from fire and ambulance and police, we share resources with one another to say, look, this is what we've been experiencing. This is how we're coping. Maybe that could be of service to you. And to hit on something else that Robert said, you can go to any other first responder who's been in that situation, and you could just have a chat with them. Majority of the time, just knowing that somebody is there who understands you gives you that access to be able to say what you feel you need to say and get that process started. So find somebody who's been there, done that, and start a conversation.
I think that the biggest myth that we have that's sort of invisible, that's not talked about, is that we're all by ourselves in our own center and our own service, and we're totally not. And areas where management tends to be very focused on what they're doing, on dealing with their own problems, makes it very hard to see the forest for the trees. And so it's difficult. It's difficult for them, and it's difficult for people in a center that is really busy, and everybody is always sort of with their hair on fire trying to put out the next fire. And sometimes we need to stop and take a breath and realize that there's a much bigger network out there, much bigger network out there.
If I could comment, I think I grew up in a first responder family, and I think the biggest strengths, there's so many strengths in the first responder community. I think one of them is the sense of family. And the family is not your family, just your family of your wife, your husband, your children, but the family of the community. And always those words that are used, my brother, my sister. And that social support is so important, that peer support, knowing that you have a community out there who has your back, 100%.
Right?
So much
Sorry, I
truth.
was going to say there was an incident we had once at my workplace prior to being on the fire service in this capacity. And so I had just gotten on, and there was, I can't go into the details of the incident, but needless to say, it was quite a big drama for me. The next day, the sector chief drove to my house, knocked on the door, and said, "Hey, Wade, how you doing?" You know, and it's that kind of connection where you start to realize, you know what, this isn't just me. And a lot of times people think, like you said, in the first responder, you know, it really is a family. And a lot of times, whether you say these words, but whether you like it or not, somebody is going to notice you, and someone's going to come to you and say, "Are you okay?" And you don't have to say yes, you don't have to say no. We're just going to be there to sit and listen, you know, but somebody's there, and that's what's important.
I think that one of the things that tends to make us feel more isolated is I learned very early on in my paramedic career what I could and couldn't go home and talk about. What my wife didn't want me to talk about and let her know that I was dealing with at work. And so if I didn't have any other network, it would have been very difficult for me to go home, not say anything, and keep it all in. But there are other people. And so that family, that extended family that you're talking about, Margaret, is a big deal. Utilize that. We're all, like I said before, we're all in this together.
Those are great responses, guys. Thank you so much for that. Our next question is more, I think, generally about needing to step out to take care of your own mental wellness. So the person asks, I think there is a level of fear that stepping out of the game to recover will cause a loss of skill or ability. What would be your recommendations to help those who've had to step out to get back into the full force confidently? And I'm going to start with Robert.
We find that in our industry, we find that in public safety communications, it happens really quickly. That ability to be able to call, take, and talk to the public, and then the secondary ability of being able to dispatch out and play the chess game that often is dispatching ambulances while balancing 3 or 4 other balls in the air. That's a skill that definitely needs to be practiced. And so one of the ways that we take care of that just through everyday life is making sure that the supervisors rotate people through the different roles so that they're always confident on a role. If you need to step out of your workplace for health reasons, whether it be mental health reasons or whether it be because you're on maternity leave, definitely your program, your work should have some sort of reorientation program to be able to bring you back into it, understanding that people that are away for a little while need to have a little bit of reorientation. And in communications, that happens by default most of the time. So while it still might be a fear of sort of going off to take care of your family and take care of your own mental health, check your policies, because your policies probably point directly to that. And if they don't, that's another thing to lobby management for, is to say, hey, what are our reorientation if I need to be away for a little bit?
Wade, why don't you go ahead and comment on that?
So I know in my personal experience, it wasn't too long ago, I had to take a 2-week period off just because I was exhausted. And what was interesting is it was the first time in 6 years I'd taken a break for anything. And stepping back for the 2 weeks allowed me to have a better sleep. It allowed me to know that I'm not going to get all those calls. I was able to spend more time with my family. And that actually recharged me, and it took away a lot of the mental fog and the stress I was having. So when I came back to work, I was so much more ready than I ever thought I would be. And then if I compare that to prior to taking the time off, I can tell you I wasn't as effective. You know, and that's why you do that. You take that time off, not just because you're thinking about, you know, what's gonna be like when I come back, which, as Rob mentioned, there's a policy in place for that. But the reason you're taking that step back is because you have to get straight for yourself, because it all starts with you.
Thank you so much for that, Wade. Ruth, do you have anything that you wanted to add?
Yeah, just what I've heard often from first responders when they do return to work is that it's so important to have a buddy and to be supported by leadership, but having a buddy that understands them and kind of pairing up with them to facilitate that return to work is often, I think, very helpful.
Margaret, anything you would like to add?
I think those are terrific comments.
Perfect. All right, Wade, I have a question that I'm going to aim towards you. As someone who does peer support, what have you found works best when providing peer support?
You can read as many books as you want on it, and you can take as many courses as you want, but the theme is going to always be that person has to know that you're there, you're not judging them in any way, and it's 100% confidential. I mean, I can talk to somebody or even just sit in a room with somebody because they know just having somebody there is important. If the chief walked in and said, hey, did you talk to so-and-so? I have full confidence saying, chief, you know, I can't answer that. And so there is absolute confidentiality. And the biggest thing is to sit there and just listen without an expectation of what they're going through. Because if they're having a tough enough time explaining it to you, then you shouldn't be trying to tell them what they think they're thinking. Mm-hmm. So when you get into somebody, you get into a situation where somebody wants to talk to you, just say, yeah, I'm here for you. I'm here as long as you need me. You know, and knowing full well that the leadership team and all the fellow firefighters and officers will support you in that direction gives you an incredible sense of strength so that you can sit with them through that storm and you can provide those resources when they ask and when they need. And it's important to let them ask on their own time. You know, that's huge. You can't force any of these issues. You have to absolutely give them the freedom to speak. You have to give them a mulligan. So if they come out and they say it a certain way and they're like, oh, that's not what I meant. It's okay. Take your time. Say it however you want. You get 100 tries, you get 1,000,000 tries. You get as many tries as you want. And so when they start feeling that they're not being judged and they have the time and the space and the freedom and the resources available, they'll come to it on their own time, and you have to let that happen.
We are just going to start wrapping up here a little bit. So I'm going to offer you each a chance just for some final thoughts. I'm going to go to Robert first, if you want to go ahead.
I think I don't have a lot of final thoughts that we haven't talked about already. Just sort of building on sort of management's role and the frontline workers' role. Just like we were in a much bigger community and that we're all in this together, your managers and your frontline staff are as well. And so there often seems to be a bit of a butting heads when it comes to management and between management and frontline staff and in some agencies and some organizations. And that's what we really need to work on first. If we can get that sort of reciprocal relationship, that trust between the two groups, then everything else becomes much easier to put in place.
Wade, I'll go to you next.
One of the first things I want to comment is a great thank you to you guys for doing this, because it's so hard to get this conversation going in a lot of ways, and usually the biggest barrier is to start it. And with the resources you put into this and getting the right people out, it's important that we see that. So thank you very much. One of the things I like to push is that if anybody has issues, please reach out, because you are the most important part of this. And people sometimes forget that. You know, it is a big machine. First responder industry is a huge machine. There's a lot of moving parts. And sometimes you may feel that you're just a piece in the big wheel, and you're a very important piece. So if you have anything you need to talk about, then you take that time. You are the most important person in that event.
Okay. Ruth, I'll go to you next.
Yeah, I'd like to thank CIPSRT for making this possible. And I'd also like to thank all the panelists, and thank you so much for the work you do. It's so important.
Right. And Margaret, I'll give you the last word here. Oh, can you hear me? Oh, it doesn't look like Margaret can hear me. So I apologize, Margaret, because you're not getting your last word here at the moment. So I'm just going to wrap things up for us. I've put a slide on the screen. Hopefully you all can see it. I want to let you know that a survey is going to pop up right after you are done logging off the town hall. We please ask that you take a few moments to complete that survey, as it gives valuable information to us on being able to improve the offerings that we have for you. A video of this town hall is going to be available. It will be sent to you in a follow-up email tomorrow, and it would also, the link to it will also be posted on our website. Please consider joining us for our town hall on Tuesday, April the 28th. It is about coping with stress for public safety personnel during this crisis. If you still have any questions and would like answers from our panel or from other experts, please submit that question to the email address provided there, covid19@cipsrt.icrtsp.ca, and we would be happy to answer those questions for you. Again, I want to say a big thank you to our presenters today and to our panelists. You all did a wonderful job and we appreciate it here. And to everybody out there, remember to take care and stay safe.